them, but I'll start recording now. Good evening, everyone. Good evening. Welcome to the third Tuesday Mastermind group. I think that's what we call it now, Paula. It used to be called all kinds of stuff.
It's all kinds of names. The Rangers. Oh, we still have the Ranger. Rangers are special. They've been with us a long time, right, Dr. Allgood? You're one of the Rangers.
I am.
Some of our
the Power Rangers. Yeah, Power Rangers would be the younger generation. Welcome, Dr. Haig. Thanks for joining us for your first Mastermind meeting. We usually have about 10 to 15 of us, Paula, depending on
that.
Yeah. So on how busy people are. I sent out a rough agenda, but we don't have to follow that. We can take your challenges and questions and concerns right out the bat. I know that Dr. DeLong has walked away from his phone, but I know that he probably wanted to talk a little bit about Triple P 2.0. So we'll touch base on that when we see him back in his camera again. And I think the biggest, he's cooking dinner. That's what it is.
Cooking dinner.
All right. So, well, did you have a specific question, Dr. Long, about Triple P 2.0? Or you want me just to hit an overview?
Just do an overview.
Okay. All right. So the biggest thing that everyone is talking about is, do I qualify? And if so, then should I apply? Oh, we got to let a couple people in here. And so pretty easy if you're using a tracker to look at 2019 versus 2020, and compare your second quarter, right? April, May, and June to April, May, and June. Just look at your total collections for each of those 3 months. And if it's more than a 25% decrease in collections, then you qualify. And then it's just, do you feel like you want to? Now, I know that I have some clients with Bank of America, and the bigger banks, I think, are giving, a bit of a harder time for you to apply, because it's their money that they're lending, not the government's money. It's their money they're lending. They get paid back by the government. So smaller banks probably have an advantage. You have a relationship with them, and it's more of an interpersonal decision, and not just a blanket, hey, we're not giving out any money at this point within this time frame to these types of businesses. So anybody already got their money? All right.
Cool.
Heads of the class. Look at that. Yeah. And Caitlin, did you go with a small bank, or were you working with a big bank?
No, I'm working with a local bank.
Yeah. Ted, what about you? Was it a bigger bank?
I don't know how big they are. I can't even remember how I found them. It's Live Oak Bank, and forget even where they are. But I had no
I remember that name, Live Oak Bank. Yeah.
You just connected with them online then?
I did the first one with them, yeah. And
okay.
They were pretty sketchy on the first one. It just wasn't easy. But the second time was very smooth. They got their act together.
Maybe for those who are listening who are struggling with the bigger bank, to help them, what's the name again, Ted?
Live Oak Bank.
Live Oak Bank. And you just found them online, huh?
I might have been referred to them. I would have guessed it was you, Eric.
It sounds familiar, honestly. I think another client. Yeah, I think another client turned us on to them. Yeah.
I think at least I heard about it probably on one of these Zoom calls, maybe.
Yeah, that was back in the spring when it first came out. And I can't remember who it was that told us about Live Oak.
But sounds familiar.
Yeah.
And then I have a doctor in Colorado who you just used an online app only process, and I can't remember the name of that institution as well, but it was just it's all a digital process. Again, no relationship with them, but found them online. So
I've heard a lot of people using PayPal.
Okay. Yeah, that's a good one. Yeah. So you should already have an account with PayPal. If you don't, Cash App or any of them. And if you're not buying crypto on Coinbase, what's wrong with you? No, I'm just kidding. Don't take me.
Yeah, that's really.
I'm on fire right now in crypto. Don't get me started. So.
Are you really?
Yeah.
That's a good thing to talk about, and maybe some other time. But yeah.
It's so easy to do. Yeah. Once you get the app, it's easy for them to take your money. Yeah. They're talking about Bitcoin hitting $1 million a coin. And it, now it's up to 49,000. So, and then Ether is the other one that kind of rides its coattails. And I think it's like $1,200 a coin right now. And yeah, it's fun to play the stock market in crypto. Anybody else buying crypto? No.
I have a client who's really
I
into
just
that.
started to
Just
look
you
into
started?
that.
Yeah.
Yeah.
Coinbase is a good
I-
app. Yeah.
Yeah, my dad helps me with a lot of investments, and the other thing to look into is investing in blockchains, because as crypto gets bigger, the companies that do blockchain, they're gonna start
That hold the money for you, right?
Yeah.
Yep. Yeah, and actually, I buy my crypto on the app called Blockchain. Yeah, it's fun. Just don't buy more than you can handle losing.
No kidding.
It's very up and down. Yeah, so it hit 49.3. Yeah, 49.3, and then Ether's up to 17. So, yeah. Yeah. Okay. So, Triple P 2.0. Anybody wondering if they should or should not apply that has any questions about it? I know Dr. Netzley, we talked about it in our last coaching call. I think you're good to go, right? Okay. All right. I don't see anything wrong with applying. Most of my clients who show more than a 25% loss in that second quarter, I mean, not only did you lose, that doesn't include March's loss as well, because we're just looking at second quarter. So, 66% loss in just the second quarter. So, and usually when we look at both Triple P funds, it usually adds up close to whatever your total loss was. So we can at least look at 2020 as a wash. And then what I and Paula have been talking about is that money that you pay on payroll now for the next 24 weeks that you don't spend of your own, we're stockpiling that. We're setting that aside in case something else can happen this year. We don't know. I mean, I was just on the phone with a client in Australia and they were just in a shutdown. It's a short shutdown, but they had a new strand from the UK in Melbourne. So they shut everything down, everything. So we just don't know.
And this week, I mean, weather's nice to have a little cushion when you got shutdowns from weather and, the ice storms, things like that. So.
Yeah, awesome. All right, let's jump to everybody's favorite topic, the vaccine.
Oh boy.
Oh boy. Yeah. So I got the vaccine the hard way in the last 3 weeks and decided I would tempt fate and become infected with coronavirus. So I dealt with that and I'm still dealing with the cough, but Dr. Netzley laughing at me. I told him I had COVID. He started laughing at me. I don't leave this box. I have no idea how I got it. One of the little vermin that run around here brought it to me. So
Fish.
yeah, probably it's the bird flu, but it's the fish flu now, huh? Oh, just trying to get back in. I mean,
Yeah, flu is like not even around.
Doesn't exist, huh?
Pretty interesting.
So, Ted, you guys get in the office, team's response to vaccines, you guys all go get it or leave it optional and say, hey, I'm suggesting it. Well, how did you handle it?
I haven't really gone to the team one way or the other.
Yeah.
They want to get it, fine. If they don't want to get it, fine.
Yeah.
I'm certainly not pushing because I'm not getting it. At least I'm leaving the door open, but I'm sure not going after it. I did hear just today from a relative who's a nurse that Johnson & Johnson has a vaccine, and it's a true vaccine. It's not RNA. It's not messenger RNA to mess up your DNA. It's an actual vaccine. Also, she's hypersensitive to metals, and she said it has no mercury or aluminum in it. So I'm gonna research that a little bit, wait if I need it. That sounds like the direction I would go myself. In terms of the team, they're about 50-50 getting it or not getting it. And it's surprising, some of the younger ones are the ones not getting it.
Yeah, I'm seeing it more
Johnson-
clinical versus admin. Go ahead, Andy.
The Johnson and Johnson, I think, is a single dose. It doesn't provide as strong a immunity as the other ones, but it's a single dose and helps cut down a lot on the symptoms, even if you do acquire the disease. It's funny, they talk about all the vaccines. Well, I want to get it because I want to be able to cross into Canada when it's deer hunting season. I figure you're going to have had the vaccine. Well, I've already had Corona, but I've been trying to get it for about 4 weeks, 6 weeks. Finally, I got a call today, and this is from Walmart pharmacy, and they said, "Yeah, we've got the vaccine. We can see you on Thursday at 2:30." I said, "Okay, great." Well, I got a call back in a little bit. They said, "Hey, I'm sorry.
We're out.
That spot is for someone who has already had the vaccine. It's for their second shot."
Oh,
They
wow.
said, we got 40 doses, and 20 of them are for the second dose and 20 for the initial. They got 40 doses. It's
Wow.
crazy.
Yeah, yeah.
I thought Dr. Biden had them. President Biden. We had all of these vaccines that were just falling out of the sky and going to cure everybody. But
Well,
Sure,
they lost
yeah.
they lost
Yeah.
20 million of them somewhere.
He owed those to China. No, I'm just kidding. Don't quote me on that. No, don't quote me on that. So not to get political. Here's what we're hearing. Paul and I are working with admin teams on this left and right. Patients been waiting and waiting and waiting to come in. And they say, yeah, I'll come in, but it's only if you guys have gotten your vaccine. Like they don't understand how it works. Like if I don't have the vaccine, but you do, I'm safe. Like they don't understand that part. So one thing that we've been working with team members on is how to handle this verbal skill. Okay. And the first thing that your team needs to know is that's private information. Like Ted's talking, it's like, I didn't tell my team what to do, what not to do. You can't mandate it for them to get it. So it's honestly none of the business of the person who's calling. Okay. So it is private information. That's the first thing. And you say that in a nice way. You say, Paula, I'm so glad that you care about your health and our health. The first thing I would say is, well, it's private health information. I really can't share that with you, just like I wouldn't share your private health information with someone. Does that make sense, Paula?
That makes sense.
And secondly is to be protected in our office, you would want the vaccine if that's what you're thinking, right? If you think the vaccine helps, it would be something on your end that you would do to protect you when you come in. Am I making sense, Paula?
Yeah, that does make sense.
Okay. And then third, I would say this. Dentistry annually has about 720 million visits a year nationally. And you know how many out of those 720 million visits we've had in the last 12 months, right? You know how many times COVID has been transferred within a dental office according to the CDC?
No, haven't heard that.
Zero have been reported.
Zero.
So
Wow, that's
yeah.
awesome.
that's a lot of visits too, right? And so we're doing something right in dentistry. So I can tell you this is probably the safest place you can go. Are you leaving your house or are you quarantining?
Yeah, I go to like Walmart or,
Yeah. So we're safer than Walmart.
yeah,
know?
I would think so.
Yeah. So you can rest assured that we're going to take great care of you and make sure that you're safe and we're safe, both of us. Okay.
Yep.
Yeah. So Paula's
Have
got
you
this.
gotten the vaccine?
Yeah, they'll go back to it, huh?
Are you
I got-
going to get the shot?
I got COVID, so there you go. right? Yeah.
So you haven't had it, have you, Dr. Vickery? Oh, okay.
Yeah. So what you're telling me is, and literally, I've had offices just like Ted was saying. It's kind of split, where the
Yeah.
clinical team is getting it, but the admin team isn't. And so it's like, how do I tell them? Some of us got it and some of us didn't. It's honestly just none of their business. So yeah.
Interesting. In my office, it's the admin team that is getting it and the clinical not getting it.
That's funny.
I just wanted to interject about the vaccine situation. In North Carolina, we did not, Wake County is where I practice is very large, and we were having difficulty with vaccine situation. We actually went into the outskirts and went to other counties that were offering vaccine to healthcare workers and got it early on. I got mine on January 8th, the first one, and the second one on Jan 29th. So they are making, and they let you come back in and get your second dose there also. So if any of you are having difficulty, please look around into other counties around you that might have surplus vaccine, because there are so many people who are not getting it. Not everybody's comfortable with it. So they have surplus vaccine sometimes. And that's how I got both of my shots, from another county.
Yeah. Yeah, makes sense.
Dr. Bashar, you're in North Carolina. Are you guys getting it, or? I know.
Well, I did the same thing. Actually, I went to a Murphy County was not. Well, I called the Clay County, which is the county right next to ours, and was able to get my first one so like a month ago, and then I got my second one I think like last week. So I was able to get mine. And usually in our office, whenever the patients ask about the vaccine, they really are asking for their own personal. And since I have gotten it, that they usually feel, they've been feeling fine about that. And then
They
the
feel
ones
safer.
sorry.
They feel safer.
Yeah, they say they feel safer, or they'll just say, oh wow, like, because some people are, I don't know, they don't believe in the vaccine sometimes, and to know that I have as like a local health person in the community, it kind of like, I give them some direction about it. And I found that most patients do feel safe coming to our office. And it has been weird in North Carolina, where the dental offices somehow haven't been really invited to the
Yes.
the health departments to be vaccinated
Yes.
with the other health official. So, it's
Yeah,
it's
we
kind
were
of
on the
it's kind of
waiting list.
Dentists aren't considered healthcare providers, huh?
Yeah, they kind of shafted us when it first came out, and some
Right.
counties were being a lot more open with their their doses. So
Yeah, that's good. Anybody else have any questions about vaccine or surrounding that, or concerns, how to verbalize it to patients or not? Yeah.
So when they ask you if you're going to get it and you don't want to get it, what do you say?
Yeah. So again, it's private information, right?
I'll pull that up
Right,
again. Yeah.
Yeah. So you just say, Dr. Nose, you just say,
Okay, thank you. All right.
we want to make sure we protect everyone's medical information. And what I can tell you though is that dentistry is safe, especially our office. We're batting 1,000. There's no COVID transfers in any dental office in all of America, according to CDC. Okay. So, and even once we find out there's one case, we're 1 out of 720 million a year. That's pretty good. Right?
Okay, cool.
All right. Now, the next level of this is you should be marketing safety in your practice. So we put that in the agenda. How are you marketing safety? So, we all probably have Weave or Solution Reach or Legwork or something in your practice that communicates to your patients. And so I've got a video pulled up, Paula, since Dr. DeLong's on the call. I figure I will share his
Awesome.
video. Yeah. So what they did, and I've got a couple examples on my Facebook page. I keep sharing them as I get them, but they just went through. Can you hear it?
No, you have
No,
to
'cause
share with
I
computer
got to share
sound.
my
Share
computer
with
sound.
computer sound. Yeah.
Yeah, let's
So
do
you have to
that.
stop and start over.
Yeah. Let's see if you can
You
hear
have
it
to
now.
stop
Give me a
sharing.
thumbs up if you can hear it.
Okay.
So we can go
Yep.
ahead, meet you outside and take your temperature.
That's Arlene.
And then escort you in the office. A couple of questions for you. Do you have a fever? Have you been experiencing?
I don't
shortness
think
of
that's a
breath?
real patient,
And have you been exposed to COVID and within 14 days?
but she's doing her screening, right?
Hi Elizabeth, how are you? Good, how are you? Good, I'm gonna start off with your temperature.
take you in. I will go to the first room on the left here.
There's Dr. DeLong. Gus Fogger. Yeah. All right. Awesome.
That's
So we're
great job.
yay.
Yay.
Good job, Dr. DeLong. Nice work. I think it only took us, 3 months of talking about it. Finally, finally got it all done and ready to go. Now, here's the thing, how to market that. You know, I'm putting that on my Facebook so you guys can see it, but you want to put that on YouTube, get your link, and then share that link on YouTube through your text messaging service. So it goes to every single one of your patients. If you got anybody sitting on the fence, they're going to see that. And you would just preface it, you know, want to see how safe we are so you feel comfortable coming to the dental office, check this out. And then the next message should be forward this to your friends so you know that we're safe. You can come in, so that they start sharing your video, and then you can watch on YouTube how many times it's being viewed, so you know if it's going to be a hit or not, right?
That's definitely a good thing to do, is to send it out in your patient communication system. I think a lot of people are missing that piece right there.
Yeah.
One thing we did that has kind of helped on our website, we actually did a page on our sterilization. Like,
That's great.
took pictures of our sterilization area and outlined how we're doing it and how we're cleaning, and that's helped a lot of people answer questions that they had.
So do you send that as a link, a link to that page in your patient communication?
We don't. That's a really good idea. But no, like if they call and have questions, we'll direct them to that, or we'll get calls and they'll be like, hey, we were looking at your website and saw that you do this. Thanks for putting that up there. Answered a lot of my questions.
That's really good. So it would just be mainly a link.
So here's Dr. Haig's site. So you can see right when I go to it, there's a pop-up, and it obviously goes through some things that they're doing. Is there something else deeper than this, Dr. Haig?
Yes, there is. So if you click out of that, if you go to maybe, let's see here.
I think I found it.
Yeah, sterilization protocol. So yeah, if you go down, if you minimize the chat thing. Yeah, right there.
There we go.
No, it's not there. So it has a picture of like sterilization and then just how we're doing it.
So what Paula's talking about, guys, just taking this link
Yep.
and sending that out through your Weave or your Solution Reach, whatever it is. Everybody's been asking what we've been doing. Here's everything we do. And you list everything out. How safe are we? And you can mention COVID, or you don't have to mention COVID. Paul and I share a client in Connecticut, and I do their Facebook page, and we did a COVID-19, safety thing. I tell you what, he boosted that post, and I mean, talk about people landing on different sides of the fences. You're a scam artist for believing that COVID's real, and all these comments. So
Yeah.
you know that once you put it out there to the public, you're going to open yourself up to those. Now, from a marketing standpoint, no news is bad news in that case, because every time somebody commented on it, we just reached more people. So
Yeah.
I was fine with the comments as long as it wasn't derogatory. I didn't hide anything. But yeah,
I censor them, Eric.
I could block them. I could delete their comment. I could, send an emoji with my tongue sticking out at them, and whatever I wanted to do. But just know that it is a touchy subject for some. So
Yeah.
yeah. Dr. Neil, did I tell you I got COVID? Did I tell you that?
You did.
Okay, he's my neighbor. I got to make sure he knows. That's why.
Full disclosure. That's
We're the
right.
COVID house in our street. Gosh.
How many
All right.
family members?
Nobody else got it. It doesn't exist.
That's private
COVID's,
information. That's private.
yeah, it's yeah. Oh, I'm recording this and putting it on YouTube. COVID's not real. I didn't. Only I got it.
Yeah.
It's not real. Yeah.
How you get us kicked off YouTube for saying that, Eric?
In my opinion, it is real because I've suffered for 2 weeks. All right. Don't get me laughing, then I'll start coughing.
Yeah.
All right. Anything else on safety, Paula? Anybody else do anything else on marketing safety?
Not in a marketing sense, no.
That was really good. It was really good.
Okay.
Thanks for sharing.
And there's
I like
more
this.
on there. You can see more of them. Go ahead, Dr. Notice what?
I like the 720 million. That's like a banner.
Yeah, I just did some rough math. How many dentists there are in the United States, how many average patients they see per day, and I just did some basic math, but it's got to be close, plus or minus 150 million.
Okay.
Okay. I don't think anybody's going to check the math, but it's close.
What was the time
All right.
frame on that, Eric? 720 million in
12 months. 12 months.
Yeah, in a year.
Yeah,
That's
in
what
a
I
year.
thought. Yeah.
Yeah.
All right. That's
In a day. Yeah, in a day, that would be Western Dental in a day. Yeah.
yeah. 80% of statistics are made up you
On
know,
the spot, right, Ted? Yeah.
Yeah,
Yeah.
94%.
Oh, 94%.
94%.
It's
Okay.
going up. It's going up. I like to tell that joke like 4 times over a 2-day period now and just increase the number every time I tell it.
Every time, yeah.
Yeah, that's good. All right, Paula, hygiene schedule.
April hygiene. How's everybody doing with their spring hygiene schedule? You know, we've got the perpetual bubble, if we're not careful, of the time that we were closed in 2020. Can you believe it's almost been a year? I mean, is that just not crazy? But we've got the last 2 weeks of March, the full month of April, and at least a couple weeks of May, where you had no hygiene patients coming in. So that could leave a bubble of empty appointments in the fall, which some of you experienced. Now we're 6 months after the fall and we're into that bubble again. So who's counting their openings ahead and really focusing on that? Very good. Yeah. This is important. So what are you finding? Who can share what you're finding? Like, is March full and April's empty, or I mean, what are you seeing? How's your team looking at this? Anybody want to share? Go ahead.
Chicha, you can go.
Oh, I actually noticed that my April was more empty. March is still better. February was definitely better than what I expected. Last minute cancellations still happening. But April is more lighter. So we're starting to work on the continuing care list. And I think it's time for me to make those videos and send it to patients. I think it's really the time. I don't know any other way of trying to get them back into.
Well, and it's perpetual, like Paula said. If you don't fix last October, you don't fix this April. You don't fix this April, you don't fix next October. And it's amazing how hard it is to fix. So remember, shorter recalls. If it's still there come April, then in May, you need to do shorter recalls for October. Okay. Put your new patients in hygiene. Don't be afraid to do that. Time to convert your super prophy patients to perio, right? Ted, what are you seeing in yours when you counted?
You know, I don't know what April looks like. Actually, if I had been in the office, I would probably know. But what I do know is that once we started tracking it, and there's a little whiteboard on the wall in the staff room with how many openings this month, next month, and the month after, and how many are getting filled. Once we started the tracking, it's amazing. Like March went from, Paula, you might remember, but I think they went from 158 openings to 50 or something. It was a phenomenal turnaround for March.
Yeah, they really, I mean, that you guys started working on this in the fall and they put the board up and everything and they did a really good job. And now I think they got a head start and they're thinking about it for spring too. So, I mean, some practices were like, we'll just cut hours, which if you can't fill it, I can certainly see that. But then that perpetuates the openings for the next.
It's not going to go
Some
away.
hygienists took the time off, took their vacation, whatever. It still leaves openings 6 months later, whatever. But, Ted, you guys have the advantage, which is an in-office membership plan. And you've got a lot of people on that, right? Hundreds.
We have over 700. So, when you figure an average adult has almost 3 visits a year. When you count in two, 3, and 4 visit patients, that's a couple thousand visits in a year. So
Yeah,
there's a lot to work with to move things around. And of course, the Advantage doesn't have any restrictions on the interval. It doesn't have to be 6 months in a day.
right,
Um,
right.
Patient pays for 3 or 4 visits, that's even easier to move those.
Well, and you have to understand the human psyche. Just like you wouldn't want to do a bonus program where you include the bonus pay in the paycheck, because then as your employee, I don't feel it. I don't even look at my pay stub. I just look what hit my bank account, right? You want to have that be a separate entity.
Mm-hmm.
When someone pays for the Advantage, it's very different than having something come out of their paycheck for benefits. I don't even feel like I pay for my benefits package through my wife's paying for it, right? Through her. But if I were to be paying for the Advantage at $30 a month, I want to go get my money's worth. I'm going to be more likely to come in because I'm paying for that
Yeah,
benefit than if it's just free from my employer,
yeah,
right?
Yeah. Well, one of the neat things that the Advantage does is it reverses the burden of responsibility to get an appointment, because for the dentist, you're getting paid regardless. If the patient doesn't make it to their appointment, you still got paid.
Yep.
So the burden's on the patient to make sure that they make use of their benefits, and it's a great reversal of that responsibility.
it really is. And then you have that flexibility on the interval of when they're coming back in.
Yeah.
You're not stuck. And then you can also research your patients, and typically your admin teams know which patients insurance companies are allowing 2 visits a year or every 6 months and a day or whatever. So you've got that option to use. You've also got your perio patients, and that's something, it's worth some research, Eric, don't you think? Did we get behind on our perio patients last year? How are they doing in their maintenance? Do they need to come in 3 months instead of 4, or, something along those lines?
Yeah, with our perio patients, we, a lot of them missed their interval. They were on 3-month interval. A lot of them missed. So we just said, well, for the next time, we'll get you in now, and let's get you in 2 months, and maybe do that a couple times so they get all 4 of their visits into the year.
Yeah. Oh, there's Dr. Netzley's house. I saw that. It's looking good. Looking really good.
How come you built such a small house, Dr. Netzley? It's like this big. What's going on there?
Well, that was Peach Blossom next to my house. You guys are talking about snow. I got sunshine and flowers. I got my windows in this week.
That's good. That's awesome.
And I'm starting to wrap it.
All right.
awesome.
Well, thanks for sharing that with us.
I want to add just to the hygiene, Paula, a couple things. One is when you don't have the volume, so if the schedule is thin, then you have to have the effectiveness. And so the effectiveness means maybe you need to consider insurance participation. Or maybe you need to play if you're in, then you maybe need to play the insurance game and make sure you're at a 45% usage rate for fluoride, that you're doing 6 x-rays annually, not 4 bite wings, that you're charging for your pano and getting it covered at your new patient visit because you're separating those by 32 days. I mean, you got to play those games in hygiene to make sure that if you can't be volume based right now, you can be production based, get your patients healthier, provide better service, and get paid for it. So what is your practice saying? Hey, we need to make sure that we address all these things. I was just working with a client in Alabama. Yeah. And, the hygienist is getting paid her daily rate. Doesn't matter. And so, and they're like, well, she's not very, production focused, and she's more care focused. I'm like, that's fine. Care is the same thing as production. but you have to think about it that way. If you think production is just about just the money, then of course it's going to be that way. Funny how a team member only thinks about it being the money when it's your money, but when it's my daily rate or my pay increase, all of a sudden I'm willing to talk about that. So it's a win-win. And
Yeah.
if you're going to get paid this much, then you need to produce this much. How do you do that? Make sure you give them some tools to be able to accomplish that. And it's just fair. It's a win for the practice, win for the hygienist, win for the patient, most importantly.
Eric, that's a really good point. I think when you're taking care of the patient, the fruit shows up. I mean,
That's
it
right.
really does. So
Yep.
few other things that can help build your hygiene department, period, not just Phil Spring, but build your hygiene department, is more new patients. And I think I've seen a lot of practices through this COVID getting a lot more new patients because they're not happy with the way their particular dentist did things, handled COVID, whatever. I've seen an increase for several practices. So you've got new patients to help fill that schedule. In hygiene, get creative about how you bring a new patient into the practice. The other thing is work your database. We've all got different softwares here, but I think we make the mistake sometimes of just working our recare list, continuing care or whatever it is. We want to work the database because when I look at reports, I'm seeing so many people in your continuing care, and it might be 50% of your active patients. The goal is 85% of your active patients. So where are those other 50% that are not in recare? Do they have a due date? Are we not running our recare list back far enough? You got to go 2-3 years back, right?
Keep going, Paula. Yeah.
Yeah. So some people don't work their past due. They don't run the report back far enough. So the best thing is to really work the database, work all your active patients, A to Z, and get everybody on board. You take your active patients divided by number of days work, usually comes out to around 10 or 13 patient contacts a day, at least research before you call. Some of them
For the whole practice?
The whole practice.
Yeah. So this is an example of what Paul is talking about. This is from 4DX, 4 Disciplines of Execution. It's kind of like a 7 Habits of Highly Effective People book. And I just read the Cliff Note version, the summaries. So this is the summary of it. I listened to it, the whole book on audio. I'm not lazy, I promise. So what happens is people can only focus on so many things. So at Morning Huddle, everybody has a scorecard for that day. Paula just talked about new patients. Is your team on board with asking for referrals? Did you do it? So you'd list out Ricky Bobby, Betty White, you list out the names, and then did you do it? And every day you'd be looking at that scorecard. Overdue patient calls, unscheduled or overdue. List out 4 people that you called. Check, check, check. Did they schedule? Okay. And then this practice chose to make their 4DX scorecard on case presentation formula. Were they using it and was it working? You could do transfer of power here. You could do whitening. You could do fluoride. You could do conversion exams. There's so many things you could do here. But this is just an example of how you can make sure that your team is doing what Paul is saying is, do you have systems in place that help control the flow of operations?
And then bonus it. These are great things to put a bonus on.
Yep.
I really like shifting your bonus around every 90 days and special project bonuses, focusing on certain things. So this is a great thing to bonus. I have teams. Dr. Bulsara, you guys did what, a $5 per person for every appointment that was scheduled, and you guys filled your whole schedule, right?
Well, I think Dr. Watson had something creative going like that, but on the topic of bonuses, I think we need to shift our bonus the way we're doing it, because I think it was based off of a bottom line and collections.
Yeah,
and our BAM has gone up, but our bonus calculation has not accounted for that. Definitely our collections have gone up by a lot too, because of having two doctors producing. So that's something that we're going to be looking at, because my 3 full months, are going to be November, December, but yeah, November, December, January, and February. So we're kind of in the middle of trying to figure out what that new BAM should be.
Yeah,
Yeah.
you need a track record. Yeah.
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 That's good. For sure. And so special projects like this, filling hygiene, are a great bonus to have.
Yeah.
So yeah, we can talk more about that. I think he did email me the other day about that question. Don't remember what we discussed exactly, but
Yeah, I think that switching around the BAM or the bonus, you're having ideas, is a good way to keep
Keep it fresh.
some of keep the practice on going on some of these things that get
you're
slipped
very
under the
right.
table.
I mean, that goes back to the human psyche thing Eric was talking about. There's been studies of Olympic athletes and NASA astronauts, and we're on 90-day cycles. Our quarter system, our seasons, we kind of operate as humans on 90-day cycles, and you got to change things up or you lose enthusiasm after 90 days. Got to mix it up. So another area of helping fill hygiene, or just really marketing your practice, is researching out corporate wellness programs in your community. So maybe you have some patients who work for a large company, and a lot of large companies have corporate wellness programs. Do y'all know what I'm talking about? Corporate wellness? Okay. Yeah, my husband retired from city government, and when I was on his insurance plan, they had a corporate wellness program, and so we had to do CE every quarter. So you could provide CE for some of these corporate wellness programs, and that brings people in to your practice. So there were several other things that went along with that, but you can get connected to corporate wellness programs in your community, and some of the larger employers usually have them, and begin to provide that CE and get in front of some of the employees. You can make videos. There are lots of opportunities there. So has anybody done that? Anybody know what I'm talking about, done that yet? That's a really good opportunity to get plugged in.
And I would just add to that, you can absolutely go this route, and you could take a small business who doesn't offer any benefits to their employees and enroll in Denvantage and say, look,
right,
pay for some or all of the Denvantage for your employees, look more attractive, and now their preventive services are covered when they come in the practice, and it's a win-win all the way around.
That's fantastic. I know I got my dentist. I noticed in our corporate wellness program, there were no topics on dentistry. And so I asked my husband to email, it came under risk management in the city government for some reason, instead of HR. And so he emailed risk management and said, hey, we're not seeing any dental related CE. And they said, oh, you're right. And so I got my dentist actually invited to speak. And so they invited him a few times. So, could be a patient getter. I don't know.
Well, it's marketing is effort, and you either throw money at it or you put effort into it. And if you want more new patients, you got to put some effort into it, whether it's asking for referrals or, taking invitations to those companies. Yeah.
Exactly.
Paula, I do want to add something to the agenda, and that is hiring. I know we only have 10 minutes, but raise your hand if you've had a challenge with hiring people post-COVID and finding people to fill the spots, right? I mean, it has been on probably, I don't know, Paula, 90% of our clients' minds, and how to fill and find people and challenges. So I don't know if anybody's found a magic wand laying around that they want to share with the group, but I know that a lot of people that are going to be listening to this would love to hear anything that worked well for you in finding new, good employees. Anybody have anything they discovered?
We're all ears.
Yeah, the magic recipe for hiring employees in the dental office. It's tough, huh? I'm using more Facebook job postings than ever. I get more unqualified people that way, but I get more applicants because Craigslist, Indeed has been just so wishy-washy, and Indeed gets expensive. And I don't know how many people are looking at Craigslist as much anymore, but it can work.
Depends on the area. Some rural areas don't have a Craigslist that's really active for them, or they draw people from an hour or two away, and it's not going to work. So it depends.
So Facebook you would do it from your business page, just so everybody knows it's not your personal Facebook page. You go under your business page and you go under your settings, and you can do jobs, and you can post a job, and they just show up with a notification on your Facebook. You got to watch it and make sure that you're paying attention to it. You'll probably get an email with a little, hyperlink under their name. You can click on it and see that they, worked at the dollar store, and now they want to manage your dental practice. So,
is there a fee, Eric, to post jobs on Facebook?
No, it's free. It's free. Yeah. And then you renew it every 2 weeks. It'll notify you, hey, if you filled this job, if not, renew it. So yeah. You want to be specific on what can qualify for applicants, and that's fine, but it doesn't prevent somebody from ignoring that and applying anyway. I was doing some interviewing for a client in North Carolina, and I probably had a 50% no-show rate for preliminary interviews on Zoom. So they apply, they send their resumes, I email back and forth from them, schedule their Zoom meeting, and about half of them don't show up for the Zoom meeting. So it's a trend. I don't know why.
Doing a Zoom meeting interview is a really super idea. I think that's top.
Well, I have to do it because they're North Carolina, but it is great because I can see them, right? I don't necessarily have to, physically have them come into the practice and meet everybody in the tour and all this stuff that may be a complete waste of time. So we just tell them the preliminaries by Zoom, and then we do secondaries in the office.
That's a great way too. I have a group practice, a large group practice, 7 or 8 locations. And, you could do a Zoom interview and see where they live and which location would be the best for them if they're hiring in several places. And with COVID, a good introduction, do a group interview. Group interviews are fun too. Do a Zoom call like this and have a group interview.
Oh, wow.
And see who really stands out. That's a cool idea. I've got a group interview instructions for in person, but you could certainly do some group interview on Zoom like this and see who's paying attention. How
what'd you say? What'd you say, Paula?
Yeah. Yeah. See who turns their camera off.
Yeah. Well, look, there's a lot from looking at a resume. I would tell you there's only a couple of things you're going to pay attention to, and that is how many jobs they've switched and how frequently. You're not really going to pay attention to references. You're going to call their previous doctors that they worked for. And not the current one they're working for, the prior ones. You're going to get permission to do so, and you're going to reach out to them and ask them would they rehire that person. And then you're going to go on social media and you're going to do your sleuthing and look them up and find them and see what sort of pictures they're posting. I had one applicant, her profile picture was her and her husband in the bathtub. So that was a quick non-interview. So yeah, that didn't work.
Wow. You never know. You never know.
Never know what you're going to find in Redding, California. So
yeah, for sure. Well,
that wasn't for your office, Dr. Nilgis. That wasn't for you guys, just so you know. He's rubbing his face like it was, but it's not. It's not.
So Eric, you want to talk about the leadership retreat a little bit?
Yeah, I do. You know what? I'm really excited. Obviously, a lot of great minds come together at the end of April for the annual doctor-only leadership retreat. And there's just going to be some really good topics. Paula finally pinned me down on my topic, which I'm actually really excited. Paula, thank you for doing that. I'm going to do, we focus so much on the tracker on the incoming. I'm going to focus on healthy guidelines for expenses. I'm also going to talk about ways to protect yourself on embezzlement as well. Very sexy topic.
Yeah.
Ted, you're going to love it, Ted. There's graphs and everything. So it's really sexy. And what else we got, Paula? Dr. Dave Pierce going to talk to us.
Yeah, Dave Pierce is going to talk to us about breaking the chains of insurance. Dave's awesome. And this is Dr. Pierce right here. And Dr. Joseph Sutton his father talked last year on ozone, which was a huge hit. We had that planned even before we knew about COVID, and lo and behold, it was awesome. But he's going to talk about 3D printing. They're using 3D printer in their office, so he's going to talk about that. Dr. Holt Gray is a prosthodontist who does lots of full mouth cases, lots of full mouth restoration and implants, and he has actually been an instructor at the Foundry, which is in Birmingham, Alabama. So we have some others that we're inviting too. So this is going to be a Zoom, a live Zoom video, kind of like we're doing right now. And we have IPSO, which is Dr. Ted Johnson. He has the International Partnership for the Study of Occlusion, and they sponsor our CE credits every year. So we're very thankful to have him sponsor our CE. So it's Friday, Saturday.
14,000 CE credits too.
14,000, yeah.
Yeah, 14,000.
Really
yeah. Or 14, that's what it is.
Friday, Saturday, April 23rd, 24th. And, we just have a great time. Really, we've been having people from all over the country, like Alaska to Maine, right?
Yeah, literally. Yeah. So I'm excited about large cases. I'm excited about reducing insurance dependence. I think that's huge.
Yeah, that's a big one, especially
be fun.
These days with the insurance companies lowering their fee schedules and raising premiums to the patient.
Yeah. I think too, one thing that we all have to be considering all the time is how do you expand your palette when it comes to large cases? And what is defining a large case? What type? So Invisalign, sedation, holistic, implant surgeries. What are you doing to allow your practice more advantages? If you're limiting the services and you're referring all this out, you're not doing things, or you're playing it safe or conservative in that regard, then you're doing your practice a disservice by not offering that. Used to be cosmetics or veneers, and that was enough. It's not enough anymore. And you need to be able to offer a full array of treatment for your patients to do one-stop shop and do it really well.
Yeah. And a lot of, I've been in several practices where I look at their cases and they're not really treatment planning full mouth restoration. And part of that is because they're not thinking about it or they're worried about overwhelming the patient. Dr. Allgood, you've done tons of full mouth cases, and you took some courses for that, didn't you? You're on mute, by the way.
Well, we did you've got to prepare yourself, and you don't get it from dental school. That's why Pete Dawson course is Pankey, and that's it elevates your practice, and it also helps your communication skills about and identifying what's going on with the patient, and letting them know. If you don't know, how you going to tell them about it?
That's right. That's exactly right. So
good.
We've got a lot of things planned, and the agenda is still developing. So
yeah, very excited. So let us know if you want to attend, whether you're here live or listening to this recording afterwards. Let us know. We'll get you in. What do we cap it at, Paula? 20?
20 doctors?
Yeah, how many doctors? That's a lot.
Yeah,
how many are we going to let in?
That's really a lot. I don't know. We might cap it at 15, 20, something like that.
Gets to be too many when everyone's talking. So I know there were questions that you probably brought. Anybody bring a question for the mastermind group tonight that you wanted to ask everyone?
I have a question.
Yeah.
But I don't know with time.
You're okay.
Well, it's just the fact that I have an employee that didn't work out, and it kind of created a mess in the insurance world and billing. So, and then it was definitely a lack of qualified applicants. So I moved a lady that wanted to get out of the back, pretty smart. She thinks right. So she had interest in being up front. So I'm having her going to become my insurance now. But I mean, to me, it's a pretty complex aspect of the practice, and it's one that I can't say I've dabbled in. I know enough, but to click the box is not. So anyway, I guess it's the training aspect. I have a returning remote employee that knows the insurance backwards and forward, but she's so busy kind of cleaning up the mess getting this gal trained is my conundrum, you know.
I would first thing I would say, Dr. Nilgis, is you don't know if it's going to work or not. It's always a risk, just like hiring, right? So don't feel bad about the hire or moving the RDA up front. I would have Bobby, RDA, follow the online person, watch what she's doing. Just watch her an hour a day and see how tell her everything she's doing. You're just going to learn by operation, right?
Record it. Record it.
That's a good idea too. Yeah, record what she's doing. Use stuff like this, like Zoom, you know. Screen share Zoom. Yeah, Dr. Haig.
I was just gonna say, I hired a gal who had no dental experience, and she's now my insurance coordinator. And there are some really good courses out there for not that much, like through Teresa Duncan, and trying to think of the other name. I can send it, but she's phenomenal now. This team member of mine, and like I said, so you're ahead of the game that she even knows dental. So she definitely, if you're saying that she's smart and can do it, she'll be able to learn it. ADOM has some really good courses too.
Is that an acronym?
Yeah, so American Academy of Office Managers.
Dental
office managers.
Or dental office, yeah.
Yeah.
They have some, but Teresa Duncan, the gal that I have, got the most out of her stuff.
And the ADA has lots of
they do.
information too. And there are videos. You can just go on YouTube.
Yeah.
And just do a search and make your own videos of how you guys
do it.
I mean, that I can't stress enough that everyone needs a systems manual, and you can start that in Word. Just have the people who are doing the jobs they're doing now type up what they do, and then make videos, take pictures. You can upload your videos privately to YouTube or in a Google Drive for your office, so the team always has access to them. Put a link to those videos in your systems manual.
Yeah.
We really, really need videos these days. Most team members respond better to a video than just in writing step by step.
Back in the day, Ted, in his practice, we just did on VHS and we just wrote it and alphabetized them. We had a bunch of VHS tapes. Remember that, Ted? How to answer the phone.
Don't know where they are, but
they were so valuable at the time.
Somewhere in the back room, I'm sure.
Yeah. Dr. Nilgis, I just forwarded you an email from Dental Claims Academy. I have no idea. I just get their stuff every day. So you could look at that too. That might be an option. So it says dental insurance, back to the basics, some training. So
I've had a lot of people outsourcing their insurance claims as well. There's
outsourcing.
Yeah. E-Assist. Yeah.
And MeduSend and dental claim solution. I mean,
is that like made you look, but it's made you send?
Like MeduSend.
Oh, okay. All right. All right. Well,
there's another one. Let's see, dentalbilling.com, which is eAssist, MeduSend, dentalclaimsupport.com. So you can have a little more consistency. If you have a lot of turnover with your team, you can outsource those things now. So anyway.
Yeah. Last thing I want to say, look, I know we joke about COVID and things like that. Please screen your employees still. Don't start getting lackadaisical. Please keep screening them. What you guys can't handle is an outbreak in your office. Okay, a small business cannot lose 25, 50% of their workforce for 2 weeks or more. Okay, we need to protect the doctors as well. Yes, Dr. Netzley, we're going to protect you especially. 3 weeks. Yeah, 3 employees. He's had 3 of his 3 employees all out. So yes, luckily he's been safe. Yeah, doctor. All good.
My daughter internship in veterinary practice up in Fairfax, Virginia. They had 24 people out.
Wow.
And had to shut it down.
Yeah, you don't want to have to shut down your building. It's too expensive. Again, another reason why we get Triple P 2.0, but it gets costly. And so I just ask you guys, keep your employees, keep the screening. Don't have them intermingling at lunch and sharing their food and spit and all that kind of stuff. Keep making this smart. Let's be smart in dentistry. I know we're a small group, but we can do things in a smart way and remember to social distance. I think that's the best protection we can do. So yeah. All right. Any other questions about things?
No.
Okay.
I got to run. Thank you
all right.
very much.
Me too.
Yeah,
All right, you guys.
Thanks for
Have a good
tuning in.
evening.
All right,
Good
everybody.
seeing you guys. See you next month.
It's great. Yep. Third
See
Tuesday.
you. Bye.
All right.
See
Good
ya.
all.
Bye, guys.
Bye.